Cerebral palsy is caused by abnormal brain development or damage to the developing brain of a child. Now, it often occurs either before a child is born, during the birth of a child, or shortly after a child is born. Hey PC lovers, welcome again to another video and welcome back to my channel. Just in case you're seeing my beautiful face for the first time, my name is Priscilla. I'm a licensed and registered health practitioner, and on this channel I share informative and educative content around motherhood, child care, maternal and child care, the mental health of a woman, and everything that pertains to us women during pregnancy, after childbirth care, how to take care of your babies, what to expect, and what you should do at every point in time. In this channel, they are really very informative and educative content, and you can't miss it for anything. Please, if you know you have not subscribed or you have not followed me, give me a subscription and hit the notification bell so that anytime I do a new upload, you will certainly be the first to know. Now, in this video, I am going to talk about cerebral palsy. Cerebral palsy is becoming very, very common in our world today. And so many mothers, they are not aware of what this condition is. They are not aware of how it comes about, what causes it, how it can be prevented, and a whole lot of things. So that is why I really want to create this awareness for every mother out there. Cerebral palsy is not a joke. It's not something that you want to risk for anything. It is not something that you want to risk for anything. So just sit tight while I be your captain, grab a cup of juice and a plate of popcorn and chill while we dive right into this video. Cerebral palsy is a disorder that affects the child's ability to move, to maintain balance, and to maintain posture. All right. Now, it is not a disease, it is a condition. It is a condition that is irreversible. All right. Now, so when you hear the word cerebral, it means the brain, and palsy, it means weakness or problems with muscle movements. So that is what the word cerebral palsy means. So it means that there is a damage to the brain, which now affects the parts of the brain that controls movement. All right. And it differs in most children. So children can have a very mild symptom or it can cause a mild damage, while some will just have very severe challenges. Cerebral palsy is the most common motor disability in children. Now, what is the actual cause of cerebral palsy? Cerebral palsy is caused by abnormal brain development or damage to the developing brain of a child. Now, it often occurs either before a child is born, during the birth of a child, or shortly after a child is born. This brain injury affects the area of the brain that controls movement and coordination. Now, there are some factors that can increase the risk of a child having cerebral palsy even while the child is in the uterus, before the child is born. Now, as a pregnant woman, if you contract some infections like rubella, like toxoplasmosis, and these infections are not properly treated, you can increase the risk of that baby having cerebral palsy when the child is born. All right. Now, when there is poor oxygen supply from mother to baby, why stay in the uterus? That is via the placenta. If for any reason that child is not getting enough oxygen from the mother through the placenta, that child, the brain of that child, that we gradually become damaged. Okay, and at this point, cerebral palsy is inevitable when that child is born. Okay, now when as a woman that is pregnant, you are exposed to alcohol, you are exposed to toxic substance, some form of drugs, madam, you are risking the life of your child. Even if you are the type that takes alcohol and you are now pregnant for the sake of the future of that child. And I'm sure you don't want to give birth to a child that will have a lifelong condition that you have to suffer for, and that child will have to suffer for the rest of the life of that child. So please, if you are pregnant, for the sake of that baby, for the sake of the future of that baby, quit alcohol. Stop it completely. Quit toxic substance, any form of drug, whatever that is not prescribed to you by the doctor. Please do not take. It also implies to even out of the counter drugs, medications that you take, once they are not prescribed and you are taking them, madam, you are risking the life of that child. Please, in the name of God and in the name of that innocent child, do not expose yourself to toxic substances. Do not expose yourself to drugs that are not prescribed by a doctor while you are pregnant. Okay? Another thing that can cause cerebral palsy is resource incompatibility or Let me break it down. It is blood incompatibility. When the blood of the mother is not compatible with the blood of the child, there is a high risk of cerebral palsy when the child is born. I'm going to make a separate video on resource incompatibility because most mothers do not even know about this. Now, another factor that can increase the risk of a child having cerebral palsy is genetic factor. So if there's any history of brain damage or brain underdevelopment in the lineage of either of the parents of that child, the child is also at risk of having cerebral palsy when the child is born. Now, it is very possible that you had a healthy pregnancy, you attended all your antenatal classes, you didn't take alcohol or unprescribed drugs, okay? Your blood as a mom is compatible with that of your child, all right? There is no genetic factor of cerebral palsy in your family. Like the pregnancy was a healthy one. And now, when the child is to be born, a lot of things can go wrong. A lot of things can go wrong, and that child will end up having cerebral palsy even after you've had a healthy pregnancy as a mom. And I feel that this is the leading cause of cerebral palsy today because we've seen cases where the labor was mismanaged. We've seen cases where a child is born, that child needs to be resuscitated. There was no oxygen in the hospital to resuscitate the baby. And because of oxygen deprivation, because the child did not get oxygen when that child ought to get it, or probably the oxygen was not available at that point, that child will need to be transferred, and everybody's running helter skelter. Before you know, every minute of that child's brain, of that child's life is at risk. For every minute, every second that child ought to have enough oxygen and do not have enough oxygen, the brain of that child is deteriorating. The brain of that child is being damaged. Okay? And this has led to cerebral palsy, increased number of cerebral palsy today. So as a mom, please be mindful of who you give birth. The truth is that during childbirth, anything can happen. We don't pray for complications, but should complication occur, that facility should be able to manage you and manage that child properly. That is why where you give birth matters. It matters. All right. So let's be guided so that we do not go through the journey of 9 months and end up having a child with cerebral palsy because of what we should have avoided. Now, another thing that can cause cerebral palsy is premature delivery or low birth weight. All right, if the weight of your child at birth is low, okay, that child, it's possible that the brain of that child is not well developed, and that child could be at risk of cerebral palsy. All right, now multiple gestation, multiple pregnancies. If you have a twin, triplets, or quadruplets pregnancy, there is a high risk of cerebral palsy. And I have seen women with twin gestation who have been cancelled to have a cesarean section, and they say, God forbid, I will give her like the Hebrew women. Madam, please do not risk the life of your children. Okay? Do not be naive. Do not be stupid or foolish enough to put yourself in a condition that you will cry for the rest of your life. Please learn how to yield to the advice of your doctor. After a child is born, there are also factors that can predispose that child to having cerebral palsy. Infection is one of them. When a child has infection, such like meningitis, okay, and is not properly managed, that child could end up having cerebral palsy. Okay, now injury or trauma to the brain of that child. If for any reason there is injury or trauma to the brain of that child, okay, of which shaking baby syndrome is also part of them. I've made a video on shaking baby syndrome. So if you have not watched that video, you should go and watch it. As a mother, you should be aware of these things so that you know how to avoid them, so that you don't be careless, okay, to have a normal delivery, a normal pregnancy, have a very successful delivery, and now when the child is born, because you are not aware, because of your negligence or for whatever reason, that child will end up having cerebral palsy. So when a child has trauma to the head of that child, it could affect the part of that brain that controls movements and coordination, and that child will have cerebral palsy. All right. Then another thing is lack of oxygen. If a child is choking or a child is drowning, okay, and there is a deprivation, there is a cut off of oxygen, okay, there is an obstruction for whatever reason that child is not getting enough oxygen, that child could have cerebral palsy. The brain of that child could be affected. So when the child is born, oxygen is everything. Oxygen is everything. Okay, and that is why even some babies they aspirate, and this aspiration has led to the death of so many babies. I've also made a video on aspiration. If you haven't watched the video, go back to my channel and watch that video. Okay, when a child aspirates, because the content that is coming out blocks the airways and the oxygen is obstructed, that child can just die from there. So oxygen is everything in the life of these children. Please. Then another very important factor that can lead to cerebral palsy after a child is born is jaundice. Is jaundice. I have made video on jaundice too. Please refer to that video and watch. That is why I say, if you haven't subscribed to my channel, if you are not following me yet, you are missing a whole lot. Jaundice that is mismanaged, jaundice that is not properly managed can lead to cerebral palsy. Please, when you have your child and you discover your child has jaundice, do not listen to home doctors, to doctors and nurses that are everywhere in your compound, starting from even your mother or your mother-in-law. They will say, go and use bomoro, go and use pawpaw water, go and use this, go and use that. Madam, once you notice jaundice, run as fast as your leg can carry you to the hospital so that that child can be properly taken care of, so that you can be counseled on the right management of jaundice. Because should you mismanage that jaundice, it will just be a mistake that you have to regret for the rest of your life. And I'm sure you don't want that. Now, there are so many types of cerebral palsy, and they are classified based on the part of the brain that is affected and the type of movement difficulty that the child has. All right, we have the spastic cerebral palsy, we have this kinetic cerebral palsy, we have athesic cerebral palsy, and we also have the mixed cerebral palsy. That is a combination of two or three of these types of cerebral palsy. Now, the symptom of cerebral palsy varies from one child to the other. Some children they have very mild symptoms, while others they have very severe challenges. All right. Some children they have difficulty with movement. They have delay in meeting up with their milestones. You see a child at 6, 7, 10, months, the child is not even able to roll over, to turn over to the other side. You lie the baby down and you go and come back, the baby is still there. At some points, the baby should be able to start rolling to the other side. But when the child is not able to roll to the other side, the child is just where you keep the child. It means that there is something wrong with that part of the brain that controls that movement. All right? You see a child that is not able to crawl, is not able to walk. The muscles are stiff. The muscles of the hands, the upper and the lower limbs, they are stiff. And of course, if these muscles are stiff, they are not flexible. There is no way that that child can walk. All right? Some children, it affects their speech. Okay? Some it affects their coordination. They are not able to balance. They're not able to coordinate their posture. They're not able to coordinate their balance. All right. Some children also have seizures. Some of them, they have seizures. All right. Some of them, they have learning disabilities. It affects that part of the brain that they're not able to learn. They're not able to comprehend. Okay. So these symptoms differs from one child to the other. Now, somebody may ask, is there treatment for this condition? Sadly, there is no treatment. Cerebral palsy has no cure. It is a lifelong disability. All you can do is to manage that child, through speech therapy, physiotherapy. You get assistive devices like walking aids, all right? You place that child on medication to help with the seizure. If the child is having seizure, it also helps with the stiffness of the muscle because it gives them a lot of pains, all right? Then there could be surgery. There could be surgery in worst cases for that child, okay? So you just have to manage the child with every therapy that you can, all right? It's a lifelong management. There is no cure. There is no cure for cerebral palsy. Now, children or adults with cerebral palsy can naturally live a meaningful and productive lives, okay? That a child has cerebral palsy is not a death sentence, okay? With family involvement, with physical, occupational therapy, and every therapy that you are advised to do for that child, okay? With love, with community awareness of what this is, okay? Involving the family, showing that child love, making that child feel loved and giving every support that you can is going to go a long way to help that child. Also try to encourage independence, all right, and celebrate every little milestone that child achieves, okay? Of course, that is where that love and emotional support comes into play, okay? with all these things put in place, they can actually live a meaningful life. Okay? Individuals with cerebral palsy, they can go to school, they can pursue their careers, they can even start up a family, they can procreate. All right? So it is not a death sentence. All they need is our love and our emotional support. It is very, very important. Remember, cerebral palsy is not a disease, it is just a condition. Okay? It is a condition that is caused by early brain damage. All right? And having this awareness, having inclusion, showing them love, all the emotional support they can get can actually help that child reach his or her full potentials. Now, if you have watched to this point, thank you so much. And if you found this video helpful, please do not hesitate to subscribe. Subscribe and share this video to everyone in your contacts. Help create this awareness. All right, you just might save a life. Until I see you again in my next one, stay blessed, stay healthy, and above all, share this awareness to everyone you know.